What are yeast infections? Yeast infections are caused by an overgrowth of a type of yeast called Candida. Candida is a normal part of the microorganisms that live in the human body, including the mouth, throat, gut, and vagina. Normally, the growth of Candida is controlled by the beneficial bacteria that also live in these areas. However, when the balance of bacteria and yeast is disrupted, Candida can overgrow and cause an infection. Are yeast infections common? Vaginal yeast infections are common. In fact, nearly 3 out of 4 women experience one at least once in a lifetime. This includes women of all ages from 12 years old to beyond menopause. However, it's during the childbearing years that women are most susceptible. What are the symptoms of yeast infections? Some common symptoms of a vaginal yeast infection include itching and irritation in and around the vagina and vulva, redness and swelling of the vulva, pain or discomfort during sex or urination, thick, white, odorless vaginal discharge that resembles cottage cheese, a burning sensation during urination. How did the yeast enter your genital area? Yeast, specifically Candida, is a normal part of the microorganisms that live in the human body, including the mouth, throat, gut, and vagina. In fact, Candida is present in the vagina of most healthy women, along with other types of bacteria and fungi. However, under certain conditions, Candida can overgrow and cause an infection. Yeast infections in the vagina are typically caused by an overgrowth of Candida albicans, which is a type of yeast. The most common way that yeast gets into the vaginal system is through the transfer of microorganisms from the digestive tract to the vagina. The rectum and vagina are located in close proximity, so bacteria and yeast can easily travel between the two areas. What causes a yeast infection? Some common factors that can disrupt the balance of bacteria and yeast and lead to a yeast infection include 1. Antibiotics. Taking antibiotics can kill off the beneficial bacteria that normally keep Candida in check, allowing it to overgrow and cause an infection. 2. Hormonal changes. Hormonal changes that occur during pregnancy, menstrual cycles, or menopause can alter the vaginal environment and make it more hospitable to Candida overgrowth. 3. Diabetes. People with diabetes are more susceptible to yeast infections, as the high sugar levels in their blood can promote the growth of Candida. 4. Immune system disorders. People with weakened immune systems, such as those with HIV/AIDS or autoimmune disorders, are more prone to yeast infections. 5. Poor hygiene. Wearing tight-fitting or non-breathable clothing, using scented or harsh hygiene products, and not changing out of wet clothing, such as swimsuits or workout clothes, can create a warm, moist environment that is conducive to yeast overgrowth. 6. Sexual activity. Although yeast infections are not considered sexually transmitted infections, having sex with a partner who has a yeast infection can increase the risk of developing one. What kind of medication should I take for my yeast infection? If you think you have a yeast infection, it is important to see a healthcare provider to confirm the diagnosis and determine the best course of treatment. Over-the-counter antifungal medications are available, but these may not be effective for everyone, and some people may need prescription-strength medication. Here are some common treatments for yeast infections. 1. Antifungal creams or ointments. These are available over the counter or by prescription and are applied to the affected area. They are usually used for 1 to 7 days depending on the severity of the infection. 2. Antifungal suppositories. These are inserted into the vagina and can be used for 1 to 7 days depending on the severity of the infection. 3. Oral antifungal medication. This is usually prescribed for severe or recurring yeast infections and is taken for several days or weeks. In addition to medication, you can also take some steps to relieve the symptoms of a yeast infection. 1. Avoid wearing tight-fitting clothing and underwear made of synthetic materials. 2. Avoid using scented products in the genital area. 3. Keep the genital area clean and dry. 4. Use a cool compress to relieve itching and irritation. If your symptoms do not improve with treatment or if they worsen, it is important to follow up with your healthcare provider. Are there natural remedies for yeast infections? There are some natural ways to treat the symptoms of a yeast infection that might help. Some natural cures have been shown to work better than others, but it's important to keep in mind that natural remedies might not work as well as prescription drugs, and you should always talk to a doctor before trying anything new. The one natural treatment that seems to help is treatment with coconut oil. When you buy coconut oil, make sure to get one that is organic and pure. Some brands may try to pass off a coconut oil blend that won't work as well, so look for 100% coconut oil. Most pure coconut oil won't smell much like coconut. Coconut oil has antifungal properties that may help treat yeast infections. You can apply coconut oil topically to the affected area. Thank you for watching this video about yeast infections. We hope that you found it informative and helpful. If you have any questions or comments about yeast infections, please leave them in the comments section below. Remember to consult with a healthcare provider if you have any concerns about your health. If you enjoyed this video, please give it a thumbs up and subscribe to our channel for more health-related content. Your support helps us create more videos like this. Thank you again for watching, and we'll see you in the next video.